Hi, this is Dr. Cheryl McDonald of Health Psychology, and thank you for listening to Health Psychology and the Burdens of the Heart. All over the world, people identify love with hearts, and if love is gone, there is an impairment of the relationship. When the mechanical heart is not pumping oxygen adequately, there is damage to cells or no growth. The heart is a token of life. There is a relationship between the physical well-being of the heart and psychology. The heart has numerous indispensable duties, and it seems reasonable for all to promote distinct methods to maintain its vitality. People need to discover ways in which to take responsibility for and care of their heart. Theories about the connection between the heart and mind are in the medical documents throughout antiquity. Some civilians, as in ancient Egypt, believed that the heart was the foundation and root of emotions. As Western medicine steadily disclosed the absence of association, thoughts about the links between the heart and mind went by the wayside. Behavioral cardiology is a novel field that is attempting to join them together again, this time with reliable scientific bonds, and this theory is presenting new approaches to the treatment and prevention of heart disease. Heart conditions include the entire cardiovascular system and are the leading causes of death in the United States and throughout the globe. The Centers for Disease Control and Prevention declare that roughly 61 million people in America have heart disease, and the World Health Organization states that 29% of all deaths worldwide are due to these diseases. The American Heart Association continues on to explaining that nearly 870,000 people died from heart disease in the United States, accounting for more deaths in females per year than the next 6 causes combined. To prevent heart disease, recent guidelines emphasize lifestyle modifications. A brief history of heart disease. To answer precisely when society originally became knowledgeable of heart disease is challenging. Heart scans of Egyptian mummies, a few 3,500 years old, present evidence of atherosclerosis, or thickening of the arteries, that most contemporary investigators thought was a condition induced by modern-day lifestyles. In ancient times there was heart disease, although it was not as widespread, not recognized, or diagnosed. Nevertheless, it is clear that Leonardo da Vinci studied coronary arteries, and professionals continue to give credit to William Harvey, a physician to King Charles, for identifying how the blood circulates through the heart. Nearly 25 years later, Frederick Hoffman, a leading educator of cardiology at the University of Halle, speculated that coronary heart disease sprang from, quote, reduced passage of blood within the coronary arteries. In the 18th and 19th century, angina, which is tightness in the chest that is often a sign of heart disease, bewildered countless practitioners. Originally defined in 1768, angina was thought to be related to blood flowing through the coronary arteries, even though many believed that it was a harmless ailment. William Osler, a cardiologist, investigated angina extensively and was one of the principal forerunners in indicating that these were symptoms rather than a disease. The cardiologist James B. Herrick reasoned that the slow progressive narrowing of the coronary arteries could be the basis for angina pain, also coining the phrase heart attack. The 1900s record a time of heightened attention, research, and understanding. In New York City in 1915, a gathering of physicians and social workers created the original Association for the Prevention and Relief of Heart Disease. This became the American Heart Association in 1924. These physicians were affected by the disease because of account of understanding little about its cause and effect, and could advise their patients little promise for treatment. A pediatric cardiologist at the Cleveland Clinic, Mason Jones, improved methods for delivering high-quality diagnostic pictures of the coronary arteries. This unique test produced an objective diagnosis of coronary artery disease feasible for the first time in history. A few years following began the practice of examining the coronary arteries with catheters that would later develop into cardiac catheterizations or coronary angiograms. In modern times, these methods are regularly applied to assess or verify the appearance of heart disease, confirming the necessity for additional treatment. In 1950, John Goffman, a University of California researcher, and his colleagues classified two familiar cholesterol types, low-density lipoprotein, LDL, and high-density lipoprotein, HDL. They found that males diagnosed with atherosclerosis had raised levels of LDL and low levels of HDL. Also during this time, Ansel Keys was a scientist who discovered while traveling that heart disease was unusual in sub-Mediterranean cultures, where people ate a low-fat diet. He remarked that the Japanese also had low-fat diets and low rates of heart disease, influencing him to speculate that fat caused heart disease. These decisions, along with the Framingham study, directed the medical profession's first efforts towards encouraging Americans to modify their dietary regimen to maintain a healthy heart. In the 1960s and 70s, procedures like bypass surgery and angioplasty were primarily practiced in treating heart disease. Later in the 1980s, the use of stents became popular to open a narrow artery, and as a result of these approaches, heart conditions were no longer deemed a death sentence. Although diagnostic standards have evolved, heart disease was not unknown before the 1900s. Nevertheless, it is accurate to say that there has been a mysterious increase in the number of cases recorded in the U.S. since 1918. Great advancements in understanding, diagnosing, and managing heart disease have been established since the 1900s, and prior to this time there was no heart disease as professionals recognize it today. Heart disease in the year 2016 has evolved into being the #1 condition that kills in the United States, although cancer is slowly catching up. The time of technology has caused life for people to be less physically active, and this inactivity makes people predisposed to developing heart disease. Before the Industrial Revolution, almost everyone earned their living and survived by performing a manual activity. With the advent of motorization, life grew less physically demanding, and manual work was replaced or assisted by machines. Cars, dishwashers, washing machines, elevators, conveyors, and vacuum cleaners became common, and modern amenities made physical activity unnecessary. Along with the shift in lifestyle, people began to alter their diet because of machines being invented to process cheese, make ice cream, churn butter, and homogenize milk. Before the Industrial Revolution and automation, such high-fat foods had to be produced manually, and now in modern times, hamburgers, fried foods, candy, and sugary cakes are staple foods. The blending of an inactive lifestyle and diet points to the escalation of clogged blood vessels, heart attacks and strokes creating these diseases of the heart to be commonplace. However, an obvious rise in recorded deaths related to heart disease was the addition of the diagnosis arteriosclerosis to the International Classifications of Diseases in 1949. The incidence of heart disease rose so clearly between 1940 and 1967 that the World Health Organization declared it the planet's most dangerous disease. In 1948, a 30-year inquiry began in Framingham, Massachusetts, recognized as the Framingham Study. This study included 5,127 people aged 30 to 62 who exhibited no symptoms of heart disease, and every 2 years the participants underwent a comprehensive physical examination that lasted 30 years and contributed valuable data for predicting heart conditions. In 2011, a U.S.-Egyptian investigation team involving a University of California professor and cardiologist Dr. Gregory Thomas examined CAT scans of mummies, discovering that nearly 50% displayed evidence of coronary atherosclerosis in one or more of the arteries furnishing blood to the heart and brain. The research was presented to the American Heart Association and formulated by Dr. Gregory Thomas after he learned about Pharaoh Meneptah at the Egyptian National Museum of Antiquities. This Egyptian mummy died at the age of 60 in the year 12,003 B.C. and had atherosclerosis. Dr. Thomas thought that some indications of atherosclerosis might still be present in other mummies, and formed a team of cardiologists and Egyptologists to scan a group of 20 in the museum. All of the mummies held high social standing. Among the findings were 16 of them in which arteries or hearts could be recognized. 9 had calcifications plainly observed in the arteries or in the trail where the arteries should have existed. The disease certainly was age-related, and males and females were affected proportionately. 7 of the 8 mummies who were older than 45 had calcifications, compared with only 2 of 8 that were younger. One of the oldest troubled with atherosclerosis was Lady Ra, who was a nursemaid to Queen Nefertiti, and died around the age of 40 in 1530 B.C., 200 years before King Tut and 300 years prior to the time of Moses. These upper-class Egyptians fed on a diet high in fat from ducks, cattle, geese, and salt that was used to preserve food, both of which are contributing factors related to heart disease. Despite some similarities, the investigation's conclusions indicate that researchers need to examine beyond current risk factors to completely explain the causes of heart disease. The functions of the heart. The heart is around the size of the fist and weighs 300 to 350 grams, or 11 to 12 ounces in males, and nearly 250 to 300 grams, 9 to 11 ounces, in females. This organ quickens up or slows down in response to nerve signals from the brain, describing degrees of physical exertion. The heart contracts and relaxes between 70 and 80 times per minute, beats around 80,000 to 100,000 times per day, and pumps approximately 2,000 gallons of oxygenated blood throughout the system. This task is without conscious awareness, because the organ is a specialized muscle, involuntary, that continually beats. There are 4 chambers of the heart, 2 chambers on each side. The upper chambers are called the atrium, and the lower ones are called the ventricles. The heart functions as 2 pumps for the circulatory system. The right atrium of the heart receives blood, which is not oxygenated, then carries blood to the right ventricle, into the lungs, in which the blood absorbs oxygen. Without oxygen, all cells die, and the heart supplies the body with a fresh supply of oxygen and nutrients that assist in removing hazardous waste material. The left atrium accepts oxygenated blood from the lungs to provide all organs and cells of the body with oxygen. This blood also distributes hormones from the glands and nutrients from the digestive system. The cells in the immune system travel throughout the bloodstream, seeking out infection, and forwards waste materials to the kidneys and liver to be filtered and excreted. The heart's 4 chambers contract or beat in an orderly manner, and is due to having an electrical stimulus, because the chamber contracts when an electrical surge moves across a particular path. This stimulus begins in a small collection of unique cells in the right atrium, called the sinus node. A detonation from these vital pacemaker cells causes the heart to contract because they generate electrical impulses. The electrical stimuli produced by the cells in the SA node travel through the right and left atrium, causing the cells of the muscles to contract, and then the electrical stimuli proceeds down the specialized cell passageway through the ventricles. The signal's arrival causes the ventricle to contract simultaneously, squeezing and pumping the blood forward along the path. The heart's physiology determines the route of this electrical stimulation, which brings about a coordinated, ordered contraction of the 4 chambers known as the heartbeat. These electrical movements flow through the tissue threads by personal communication from cell to cell via channels named gap junctions that synchronize the contraction. If the pacemaker misses, the cells do not get their move-along command, and the heartbeat slows down or becomes erratic. Emotional reactions can alter the heart rate pertaining to this electrical discharge, and this is one of the physical connections that relates to psychology. People can learn to regulate emotional reactions, therefore reduce the stress that it places on the heart, and at times reduce heart rates when there is no major physical damage. One example is that the rate of the heartbeat can be regulated and influenced by physical exercise. New research endeavors to transform ordinary cardiac cells to pacemaker cells by expressing a master regulator gene to replenish those lost by disease or injury. In the absence of an electrical impulse, the heart is relaxed, with the threads held apart by a protector protein termed troponin C. The mysterious ion that produces the contraction is calcium. Every electrical surge discharges calcium that connects to troponin C and pushes it out of the way to trigger a contraction. However, the calcium is promptly captured and moved back into stores, so the heart relaxes before the process begins again. The EKG measures this electrical heart rhythm when people have this diagnostic examination, and physicians are evaluating the heart's electronic path for manifestations of injury. How the heart relates to blood pressure. A. The first stage is systole, is when the ventricles of the heart are squeezing or contracting, which results in blood being pumped out to the lungs and onward pushing through the rest of the body. This is the top number of the blood pressure. The second stage is diastole. The ventricles of the heart are relaxing, and the atriums of the heart are filling with blood. This is the bottom number of the blood pressure. There are numerous physical illnesses related to the heart. Cardiovascular disease includes many disorders. These conditions alter the blood vessels, which are veins, and arteries leading to and from the heart or the heart muscle. Women who have cardiovascular disease tend to exhibit forms that affect blood vessels, while men develop conditions that impact the muscle. Conditions such as diabetes mellitus, hypertension, and hypercholesteremia are causes of cardiac disease. The list of cardiac diseases are numerous. 1. Angina pectoris is a heart disease that causes severe mid-chest pain or discomfort on the left side of the chest, with pain in the jaw, throat, stomach, and between the shoulder blades. The thickening of the arteries supplying blood to the heart causes this discomfort. 2. Aortic aneurysm is a bulge or outpoaching of the main artery, the aorta. These bulges can occur in the abdomen, below the kidneys, or the chest cavity. The aneurysm occurs when the lining of the aorta becomes weakened and thin by the buildup of plaque. Aneurysms are very dangerous because of the possibility of rupturing, thereby causing massive bleeding. 3. Atherosclerosis is the disease process caused by plaque buildup, cholesterol, fatty substances, in the inner lining of an artery. Over time, the plaque ruptures the lining that in turn produces blood clots. These blood clots inhibit blood flow to the cells, causing them to die. Complications of a blocked artery can lead to the development of gangrene, heart attacks, and strokes. 4. Cardiomyopathy in the strict sense means heart muscle disease. Cardio equals heart, myo equals muscle, pathy equals disease. Cardiomyopathy is the breakdown in functioning and health of the heart muscle. Those diagnosed are at risk of developing arrhythmias, irregular heart rhythms, that precipitate unexpected cardiac death. And there are two types. Dilated cardiomyopathy is more common and relates to the heart cavity having inflammation. Progression of the disease includes the development of arrhythmias and congestive heart failure. Hypertrophic cardiomyopathy is the growth or thickening of the wall between the ventricles, creating a blockage in blood flow. Physical symptoms include chest pain, shortness of breath, fainting, and dizziness. 5. Congenital heart disease is an error that takes place during the development of the heart during pregnancy. The blood vessels near the heart or the heart muscle develop improperly. Researchers and physicians often do not understand the basis of the defects, but some attribute the mistakes in the development to viral infections, poisons, or drug and alcohol abuse during pregnancy. 6. Congestive heart failure is a chronic disease that tends to deteriorate over time. Congestive heart failure is characterized by the heart's inability to adjust to the amount of blood flow in the 4 chambers. The disease process usually begins with left-sided heart failure and impairs the functioning of the left ventricle. At times, heart failures occur on the right side and can at times affect the complete heart muscle. 7. Coronary artery disease is when the arteries around the heart become hardened and narrow because of plaque buildup, atherosclerosis. This gradual buildup of plaque can lead to chest pain, heart arrhythmias, heart failure, and heart attacks. 8. Coronary heart disease refers to the heart's inability to provide sufficient circulation to surrounding tissue and the cardiac muscle. It often co-occurs with coronary artery disease. However, coronary heart disease can have other causes, such as spasm. Conditions provoked by coronary heart disease are myocardial infarction, heart attack, and angina pectoris, chest pain. 9. Endocarditis is a well-known disease describing inflammation of the inner lining of the heart, or endocardium. Inflammatory heart disease is inflammation of the tissues surrounding the heart or heart muscle. The most common structures affected are the heart valves. 10. Heart murmurs are faulty heart valves, which lead to regurgitation of blood or constrict passage of blood through the valve's opening. A systolic murmur is detected when the heart muscle contracts. The diastolic murmur occurs when the heart muscle relaxes in between beats. Heart murmurs can sound remarkably soft to exceptionally loud, and the different qualities are identified and heard using a stethoscope. During pregnancy, fevers, and toxins can produce heart murmurs. Hypertensive heart diseases are induced by high blood pressure. Ailments include congestive heart failure, coronary heart disease, cardiac arrhythmias, left ventricular hypertrophy, and hypertensive cardiomyopathy. 12. Peripheral vascular disease is of 2 types. Organic peripheral vascular diseases are abnormal blood vessels surrounding the heart and the brain. This ailment can cause narrowing of the blood vessels that supply oxygen and nutrients to the kidneys, stomach, arms, and legs. Functional peripheral vascular diseases do not reveal anomalies in blood vessels and are produced by spasms. Symptoms include numbness, a cramping pain, and may involve some skin discoloration. 13. Valvular heart disease is the process that alters one or more heart valves. There are 4 primary heart valves which may be influenced by this illness: the aortic and mitral valves on the left side of the heart, and the aortic and tricuspid valves on the right side of the heart. The psychological factors related to heart disease. The National Institute of Mental Health in 2013 states that up to 65% of coronary heart disease sufferers who have a history of having a heart attack experience some form of depression. Although these symptoms are not unusual, they should be treated as soon as possible because major depression can hamper the recovery process and worsen the disease. Prolonged depression associated with cardiovascular disease contributes to subsequent strokes and heart attacks. Many people may believe heart disease correlates solely with physical actions: a lack of exercise, poor diets, smoking, excessive drinking. However, attitudes, emotions, and thoughts are equally significant. Thought processes can accelerate the onset of heart disease and hinder taking concrete strides to promote health and prevent disease. Some heart patients may sense a loss of control over their life with taking medications, making time for exercise, and giving up favorite foods. Making modifications in everyday life is not an easy task, because it takes training to instill these new practices and develop habits. To sneak a cigarette or to cheat on a diet may satisfy an immediate desire, but will hinder the long-term goal of improving health. Cultivating a healthy lifestyle can diminish the risk of heart disease or manage the condition, even if a higher risk is due to uncontrollable determinants such as sex, family history, or age. Psychological determinants influence health directly, such as stress causing the release of the hormone cortisol, and indirectly via behavioral decisions that harm or preserve health. Health psychologists use a biological, psychological, and sociological guide in recognizing health practices. These methods center on understanding wellness to be the result not only of biological processes, physical, hormonal, and endocrine functioning, but also of mental processes, such as approaches towards health and how people cope with stress in their lives. These clinical psychologists then look at factors that relate to socioeconomic status, culture, and ethnicity to formulate treatment plans, interventions, and prognoses. Research confirms that while roughly 20% of the U.S. population endures an episode of depression in their life, the number soars to 50% among those with heart disease. Long-term investigations report that men and women diagnosed with clinical depression are more than twice as likely to acquire coronary artery disease or experience a heart attack. Heart disease has several brain, mind, and body associations. Prolonged stress due to difficulties at home or work can contribute to circulation problems that link to high blood pressure and other heart conditions. As with many conditions, anxiety effects vary from person to person. Some manage stress to motivate, while others may lose their temper and become frustrated. How people manage tension influences cardiovascular responses. Studies have shown that when stress consistently makes someone irritable or angry, the person is more likely to develop heart disease. In fact, how people respond to stressful situations may be a greater risk factor contributing to the development of future heart-related ailments than high cholesterol or smoking. Clinically depressed people are at substantially higher risk of suffering a heart attack or stroke, and they are twice as likely to suffer heart-related conditions. Depression can also hamper recovery from a stroke, recuperation from heart surgeries, and heart attacks. The tension or anxiety is associated with the immediate shock of coming so close to death, along with the added fear of possibly having a long recuperation, as well as the worry that another, potentially more dangerous event could occur without warning. Kranz and McSeamy found that the pervasiveness of heart disease in sufferers of depression is high, making the connections between heart disease and depression obvious in investigations of community representations and those with depression. They also illustrate the ties between heart disease and psychological determinants involving type A behavioral patterns, anger and hostility, and fatigue. Understanding and harnessing psychological factors can improve health by working directly with individual patients, indirectly in large-scale public health programs, or by training healthcare professionals. Health psychology can be associated with a similar field of clinical psychology, with divisions within health psychology, which include public and occupational health. The relationship between psychosocial determinants and heart disease is so clear that cardiologists should begin the conversation by questioning patients about stress, energy, mood, and support systems. Although changing, most conventional cardiologists do not, at least at this point in time. Psychosocial factors related to heart disease. Psychosocial factors have been associated with increases in tumor necrosis factor, interleukins, and C-reactive protein. all of which are signs of increased inflammation, which represents significant parts in developing the artery clogging atherosclerosis. Psychosocial determinants could impact heart disease via a secondary physiological route. Psychosocial determinants could impact heart disease via a secondary physiological route through practices that point towards heart disease or away from it. For example, isolation or depression can hinder people from taking the heart medications they need, while a positive viewpoint or an active social network can assist people watch their weight or stop smoking. There are plenty of theories of how social conditions, behaviors, and emotions affect heart disease. However, studies related to stress hormones top the list. Stress hormones speed up the heartbeat, constrict blood vessels, and cause them to be exceptionally sensitive or reactive to further stress. Psychosocial determinants affect heart disease in two fundamental directions. Some factors attached to atherosclerosis, the gradual destructive means that weaken artery walls, placing people at risk for a stroke or heart attack. Other circumstances add to direct attacks that trigger a heart assault or stroke. Many researchers discuss a comprehensive international study affirming that the psychosocial determinants to heart attacks are on a level with obesity, high cholesterol, smoking, and high blood pressure. Their conclusions did not just relate to the wild-paced world of the West, but in China, the Middle East, Hong Kong, Africa, and Latin America. Below is a summary of the results of this study of Rosengren and Hawken in 2004. 1. Anxiety. Intense fear, the kind associated with heights, crowds, enclosed places, snakes, and the like, can at times produce a sudden cardiac arrest. These often fatal heart attacks occur when the heartbeat abruptly becomes fast and irregular. 2. Anger, hostility. In the Harvard-based Determinants of Myocardial Infarction Onset study, 1 in every 40 heart attack patients report an incident of agitation in the 2 hours before the heart symptoms developed. Anger can trigger heart attacks. Atherosclerosis appears to progress faster in people who score high on hostility or anger ranges. 3. Depression. People who display the symptoms of depression after a heart attack, stroke, or heart surgery, or the onset of heart failure, do not manage as well as those who are not exhibiting signs. Indications of depression, as well as full-blown major depression, contribute to heart disease. 4. Unexpected emotional stress. Sudden emotional disturbances can set off a critical but irreversible heart failure named broken heart syndrome. Researchers at Johns Hopkins have documented its occurrence in people after a loss in the family, a surprise party, a burglary, a car collision, and even fear of talking in public. 5. Chronic stress. Persistent stress that associates with a shaky marriage, financial difficulties, work-related problems, taking care of a parent or spouse, or residing in an unsafe community correlates highly with the appearance of heart disease. People that have chronic stress also have challenges with rehabilitation following a diagnosis. 6. Support groups. Social isolation is nearly as significant as high cholesterol, high blood pressure, and smoking at prophesizing long-term treatment survival among heart attack victims. Heart disease risk factors. Genetics, or a positive family history of chronic heart disease, is known to increase the risk. Hypertension, or elevated blood pressure, accelerates the atherosclerosis process, especially if hyperlipidemia or high triglycerides are present. This combination plays a significant role in the development of heart attacks. However, heart attacks can be prevented and managed if people are diagnosed early and if they understand the recommended dietary treatment plan and follow instructions. Diabetes mellitus. The risk of developing a severe heart disease is 2 to 3 times more among diabetics. Type 2 diabetes, in most cases, is a highly preventable disease. Although this is currently controversial, the normal cholesterol level is under 200 milligrams. Cholesterol has two components: the low-density lipoprotein, LDL, and high-density lipoprotein, HDL. LDL is most directly associated with coronary heart disease. However, high-density protein, HDL cholesterol, is considered to be protective against development of coronary heart disease. It should be more than 40. Oral contraceptives lead to higher systolic and diastolic blood pressure, which in turn increases cardiac risk. Being overweight is associated with high rates of cardiovascular deaths and heart failure with different rates among men and women. Obesity affects the blood pressure, increases levels of lipids in the blood, and increases the risks for developing type 2 diabetes. Smoking. The toxins in the cigarette and the associated inflammation are considered to be one of the main causes of the development of atherosclerosis. Atherosclerosis is a thickening of the walls of the arteries, which results from the accumulation of fatty plaques, scarring, and hardening of the walls. Physical activity is associated with high risk because inactivity increases the lipid levels in the blood. Physical inactivity and diet are considered to be leading causes of obesity, lipid panel abnormalities, elevations of blood pressure, and diabetes mellitus. Alcohol intake of more than 3 drinks a day has a harmful effect on the heart muscle. Heavy drinking raises the triglyceride level by supplying excess fats into the body's circulation. Over time, heavy drinking can damage the heart and leads to high blood pressure, stroke, and congestive heart failure. Multiple risk factor combinations. Increased body weight is a good example of a risk factor for heart disease that plays a role for the development of other risk factors, like increased lipid levels in the blood, elevation of blood pressure, and other diseases like diabetes mellitus. Multiple risk factors significantly increase one's chances of developing heart disease. Psychological and behavioral tips on how to prevent heart disease. 1. People are in command. The brain reports to the body and the body reports to the brain. Anyone can learn to manage their mental self-talk to improve health. 2. Take time out each day to relax. Begin to take note of things that cause stress. Try to accept the fact that some situations are not reversible. 3. Take responsibility and care for the body. Get enough sleep. Exercise on most days. Eat a healthy diet. 4. Control stress at work. Leave work at lunchtime and take a short walk or relax outside the business environment. Take a 15-minute leisure break to practice a relaxation exercise. Switch from caffeinated to decaffeinated coffee or herbal tea. 5. Get the help. If people have a hard time managing the stress alone or are using habits such as drugs, alcohol, or cigarettes to diminish the tension, they may require help discovering ways to regulate anxiety. Here are a few of the many possibilities: individual counseling, group counseling, support groups, self-help books, stress management courses. 6. Take control over the schedule. Prioritize what needs to be done every day. 7. Avoid negative self-talk. Try not to concentrate on situations in which there is no control. Take a moment to give recognition for jobs well performed. 8. Learn relaxation techniques and applications. There are many techniques: mindfulness, yoga, visualization, focusing, deep relaxation, just to name a few. In conclusion, the stopping of the heartbeat always results in death that applies to everyday language that we associate with love. People identify love with hearts. If there is no love, there is destruction of the relationship. If there is no love of the heart is not pumping oxygen adequately, and there is destruction of the heart. it seems reasonable for all to develop new ways to maintain its strength. Health psychologists enhance the recovery of cardiac patients by providing tools to cope and ways to manage the physical changes associated with this disease. They focus on primary and secondary prevention by utilizing strategies to address the emotional and behavioral barriers in building lifestyle changes. This is the work of the health psychologist, who employs a biological, psychological, and sociological approach strategy. This is Dr. Cheryl McDonald, and thank you for listening to Health Psychology and Burdens of the Heart.